Good afternoon, respected judges. So I'll be presenting my work on systemic evaluation in patients with central serous choroidopathy, a prospective case control study. Central serous chorioretinopathy is a pachychoroid disorder, and the pathogenesis and treatment of CSCR is very ambiguous. What is the most accepted hypothesis is that it occurs because of increased hydrostatic pressure and hyperpermeability of the choroidal vasculature that leads to the breakdown of the overlying RP barrier. Now, various studies have been done in the past to evaluate the systemic risk factors for CSCR, but the lacunae in these studies is that majority of these studies are retrospective in nature, depending on the historical data, or they have smaller sample size and lack case controls. So we took a study with an aim and objective of assessing the systemic profile of patients with CSCR compared to controls, not just based on the historical data, but also supported by clinical and biochemical evaluation. It was a case control study, and it recruited 87 cases of acute or chronic CSC with no other ocular pathology, and 82 controls with patients with primary non-traumatic rhegmatogenous retinal detachment with no history of ocular steroid use, just so that we have a matching control group with visual loss present in both the groups, as visual loss can be a stressful incident and can lead to a different biochemical profile in the patients. A detailed ophthalmic and systemic history was taken, and detailed biochemical investigations were performed. Sleep apnea was also evaluated in these patients using a Berlin questionnaire, which is a validated questionnaire for obstructive sleep apnea. Appropriate statistical tests were performed, and univariate and stepwise multivariable analysis was performed to identify the risk factors for CSC. So coming to the results, in the history-based clinical features, alcohol use, sleep disturbance, gastroesophageal reflux, psychological disorders, and history of tuberculosis were found to be significant in univariate analysis. Use of systemic steroids and obstructive sleep apnea risk was not significant different. In the biochemical assessment, we found that the cases had better hemoglobin levels, higher systolic as well as diastolic blood pressures, and lower T3 and TSH levels as compared to the controls. When we compared the thyroid state between the two groups, it was found that the significantly more patients had a dysthyroid state as compared to controls. On performing a logistic regression of now the factors which were significant in univariate analysis, we only found that alcohol use, sleep disturbances, self-reported sleep disturbances, and dysthyroid state on biochemical evaluation were the significant risk factors. So coming to the discussion, it may be that the idiopathic CSC, which is unrelated to exogenous steroid use, the treatable medical and social factors are more important here. Like we found that alcohol use, sleep disturbance, and dysthyroid state were significant factors in our study. In a recent meta-analysis which has been done, it has been found that in Asian population, steroid use is not a significant risk factor. Now, this is exogenous steroid use we are talking about, but it could be that endogenous cortisolism is there in such patients, and previously studies have pointed out that not only an elevated 8 AM serum cortisol, but it could be a diurnal fluctuation that is more important in these patients, and overall 24-hour cortisol levels may be high. Now coming to the thyroid hormones. Now thyroid hormones, it is in the previous literature, it has not been evaluated thoroughly, but thyroid hormones increase the metabolic clearance of cortisol, and they also modulate the adrenal receptors. Therefore, they may have a role in the pathogenesis of CSCR. And in our patients, we had T3 and TSH levels low in our cases as compared to controls, suggesting a central hypothyroidism and maybe a hypothalamus pituitary axis dysregulation. So the limitation of the study is that the serum and urine catecholamine levels were not tested, and as I pointed out, only morning 8 AM serum cortisol levels were tested, and sleep apnea was not further evaluated using polysomnography. To conclude, this study reports possible association with deranged thyroid hormones, and it paves the way for future research into role of choroidal imaging in hypothyroidism and effect of thyroxine supplementation for treatment of CSCR. Thank you. These are my references.
How many cases?
87 cases were included and 82 controls.
Questions?
Why you have compared the CSR case with retinal detachment?
So because visual loss is itself is a stressful incident. So if it is already normal patient group which doesn't have a visual loss, then different comparison because if we take healthy controls, they'll not have any stressful incident. And
age matched controls also.
we took age matched controls